Hello everyone. Our lesson for today is about drugs and disorders of the nervous system. The objectives for this lesson are to know what is meant by drug. So by the end of this lesson, you should be able to give a definition for a drug. And also you should be able to list the main types of drugs. And you should be able to understand the effects of some drugs on the nervous system. And also you need to be able to understand that the nervous system it's not always work perfectly. You should be able to understand why it's not always working perfectly. Types of drug. Firstly, we should know what is the definition of drug. So if we want to give a definition for a drug, we will say drug is a chemical substance that modify or affect chemical reaction in the body. Or you can say it's any substance that change the way our body acts. Then medicine. Medicine, definition for medicine. Medicine is a chemical treatment for an illness or disorder. Now, you will say, okay, what is the difference now between drug and medicine? Both of them, they will change the way our body acts. Drug, it's a general word. Medicine is a kind of drug. So here, medicine, it's a kind of drug that it's used to treat the illness. For example, you have antibiotics. Antibiotics are drugs which are medicines. Okay? Antibiotic, it's a medicine and it's drug. Okay? It's a drug. Why? Because it will change or it will modify the chemical reaction in our body. Okay? But why it's a kind of medicine? Because we will use it to treat an illness in the body. So all medicines contain drugs. For example, aspirin tablets contain the drugs acetylsalicylic acid, but not all drugs are medicines. Okay, focus on this one. Not all drugs are medicine. What's that mean? Some of the drugs, or in another word, we will say drugs. We have two types of drugs: good and bad. Good one, the one that we use it for treating illnesses. This we call it medicines, and the bad one, we will talk about them later. Now, uh, some drugs act directly on the nervous system. These are often grouped according to the effect they have. Now, here what do we have? We have classification of drugs, kinds of drugs, depending on how they affect. The first one, the first group, stimulants. Stimulants, the function of it, it's what? It speed up chemical reactions. It speeds up the action of the nervous system. Okay. Example: caffeine. When you will get caffeine, okay, what will happen? You will feel you got energy, and you will be awake for a longer time. So nicotine also, it's an example of stimulants. Then depressant. Depressant inhibit, slow down the action of some parts of the nervous system. This they use it. For example, people those they can't sleep. Okay, maybe it's like because of any kind of emotional problems, something like that. So the user feels sleepy, okay, and less anxious when he will take this kind of drugs. Examples of it: alcohol, cannabis, barbiturates. Then, narcotics. Narcotics act like depressant, but particularly target the brain. Okay, they work as painkiller and may bring about feeling of drowsy well-being of euphoria. Narcotics such as heroin. Now, narcotics and depressants, they are the same. They do the same thing, but narcotics, okay, they are more specific. Okay, here they target a for example, specific position of the specific part in the brain. Okay, also they call them painkillers. Example of it, it's heroin. Then the last type, analgesics, are mild painkillers. Example, aspirin and paracetamol are widely used analgesics. So again, drugs. Drugs are classified into many groups depending on how they affect on the body. The groups are 1, 2, 3, 4. Another kind of drugs, we call it social drugs. Social drugs may be abused. A drug that is taken for non-medical reasons can be described as a social or recreational drug. Example includes legal drugs such as nicotine in cigarette smoke, and alcohol, and illegal drugs such as amphetamines and LSD. So another kind of drugs, we call them social drugs. We have two types of them, legal and illegal. The legal one, it's nicotine and alcohol. The illegal one is amphetamines and LSD. This kind of drugs, these drugs are taken for the pleasurable sensation. Okay, they take it for feeling, for example, feeling high or to relax. Okay, but one problem about this kind of drugs, users may become dependent on the drugs because they are unwilling to give up this pleasurable sensation. It means when, for example, let's take smoking as an example. If someone will start to smoke, okay, smoking it's for a reason, okay. When someone will start smoking, then he cannot quit. Why? Because if he will try quit, the effect of this nicotine, it will keep showing on the body. Okay, this physiological or emotional addiction may then be followed by a physical addiction. Okay, so a person becomes physically addicted to a drug when the drug is necessary for the normal working of the body. If the person, here you should focus, if the person cannot get the drug, what will happen? Then he or she will get withdrawal symptoms. What's that mean? Someone suffering withdrawal from heroin, if someone is taking heroin, then what will happen if he will not get it at specific time, or if he will not be able to get it anymore? For example, he may vomit, tremble, sweat, okay, and have severe abdominal pain after a little as 4 hours without the drug. So social drugs, you take it to feel high, but it has the negative side of it, or the negative effect of it. It's when you will try to quit from it or to stop taking it, or if you are unable to take it anymore, physical some physical symptoms will show on your body, as we said here: vomiting, tremble, sweating, and so on. Now, The dangers of abusing social drugs. Now, the negative part or the negative side of taking these social drugs. It's like when we explained here some symptoms, it will shows. Okay, now again, what more things it will happen to that person? For example, malnourishment as drugs depresses the appetite. What's that mean? If someone he got used to take specific kind of social drugs, then when he quit or if he couldn't, this it causes malnourishment. Okay, malnourishment, it means it's like when someone he is not getting enough amount of nutrients. Okay, so he will not be able to eat anymore, he will not be able to eat food anymore. Then financial problems. Some drugs are expensive, so if someone he will get addicted to it, so that's mean this will cause some financial problems to him. Then infections. Infections, what do you mean by it? As you know, some drugs they are taking it by injecting, okay, by using needles. Okay, some of these needles maybe they will share, maybe two or three people they will share the same needle. If any one of these three people they have or he have any kind of diseases, so what will happen? This disease it will transfer to another person. Example, for example, people with people that are taking drugs. If someone of them he have, let's say, HIV, which it's AIDS or AIDS. Okay, if two or more than one person will share this needle, so both of them or all of them they will have the same disease. Okay, dangerous from other substances mixed with the drugs. Some drugs, if you will take drugs and mix it with something else, another substances, maybe they will cause maybe they will produce a very dangerous substance, and maybe it cause death. And the drug may also lead to dangerous behavior. For example, poorly coordinated. For example, if someone he is drunk, and if he will try to drive a car, so he cannot control his body, so he cannot control his muscles. So in this case, maybe will have or will make a accident. Drugs may affect the central and peripheral nervous system. Drugs, as we said, it affects on our nervous system. We took the examples, for example, alcohol, okay, alcohol, nicotine, how they affect our body. We just explained before. One more thing here, it's about drugs many drugs have their effects at synapses. If you remember what we mean by synapses we said it's two neurons, okay, the area or the gap where two neurons connect with each other. This is a neuron or a nerve cell, and here is the next nerve cell. They connect with each other by releasing some chemicals. These chemicals we call them neurotransmitters. So some drugs it will affect on the concentration of these neurotransmitters. So then when it will change the concentration, of course it will change the effect of it. So this is how drugs it affect the nervous system, or the central and peripheral nervous system. Alcohol is the most widely used drug. Alcohol is an unusual drug in that it's widely available legally in many countries. Alcohol, it's something legal most of in all countries it's legal. So most of people they can get it easily. Uh, Although some countries they don't accept alcohol for any person. For example, they depend on the age of the person, but it's still even teenagers they can get the alcohol by many ways. Okay, uh, as we explained before, and you said alcohol. It causes many negative, it has a negative effect on our body. So below here we have some effects of the alcohol in or to our body. For example, firstly, cardiovascular effect. Cardiovascular effect, it means how the alcohol will affect on our blood vessels. Okay, so cardiovascular effect include anemia, alcohol poisons bone marrow, and increased deposits of fat in the coronary artery. Here what is happening when you drink a lot of alcohol, this alcohol it will help forming fats in the blood vessels, especially in the coronary artery. Okay, so in this case, when the coronary artery will be full of fat, so the blood it cannot will not be able to pass easily through it. Then another effect which is it will affect on the skin blood vessels. So when someone will drink alcohol, so the body temperature will increase. Okay, and the body feels warm and comfortable, but hypothermia may result at low environmental temperature. But sometimes you will have a kind of you will have something in our body, we call it hypothermia. Hypothermia, if you remember what we mean by hypothermia, it's a condition when the body temperature is low. Okay, so in some cases if you will drink alcohol, your body temperature will be low, especially in environmental that has low temperature. Then, 1 unit of alcohol. What do you mean by 1 unit of alcohol is our body is able to process the alcohol that we drink. Okay, so alcohol, when you drink it, it goes to your liver. So your liver, it has a capacity, it has a specific limit of processing this alcohol. So if you will drink a lot, then your liver will not be able to process all of this alcohol. Then also it affects on sex organs. Sex organs are stimulated but do not work well. Sperm count may be reduced. If you will drink alcohol, this alcohol it will stimulate your sex organs, but in another side what will happen, it will not work well, and also it will affect on sperm number. For example, for male, when the sex organs will produce sperms, so the number of sperms will decrease. Intestines, also it affect on intestines. So when you will drink alcohol, this alcohol it will affect your intestine. It will affect it cause indigestion. Indigestion, it means when your digestive system it's unable to digest food properly, and maybe it causes nausea, diarrhea, and ulcer. Then, in pregnant women, it has a negative effect on pregnant women. Maybe you hear that they say that pregnant women she should not take any kind of drugs or alcohol during pregnancy, especially during the first 3 months, because in this three or during these 3 months the embryo is still developing, the body is still dividing, making new cells, developing the body systems. So this alcohol, it will stop all of these processes. So the baby will born with maybe it's like small size. Okay, so this is small size, and also it caused some problems to the nervous system of it. This is called fetal alcohol syndrome. Also, it affect on the liver cells, it affect on the kidneys, okay, and it affect on the tongue. It cause cancer to it. The risk of having cancer, tongue cancer, it increase for people those they drink and smoke. Disorders of the nervous system. In addition to the disorders that we mentioned before or here because of the drugs, still the nervous system can get some diseases from other substances, not only from drugs. For example, uh, Alzheimer disease. Okay, some may strike at any, such as multiple sclerosis. Some are caused by infections, as meningitis. Okay, so here are some examples of disorders that it affect the nervous system. Again, these disorders, some of them it came from diseases, others it comes from another sources. So your task, it's questions, solving the questions of this topic. This was everything for this lesson. I hope everything was clear. Please, when you will watch the video, write a comment. And again, if you have any questions, concerns about the topic, please don't hesitate to text me. Thank you.